course, culturally competent care makes patients feel heard, included, respected. And if I feel all those things, then I'm much more likely to adhere to what you have to say. Studies show that doctors assume Black and low-income patients are less intelligent, less likely to adhere their advice, and more likely to engage in risky behavior. So if I assume these things already and I'm not aware of this, again, bias and competent, I'm not going to connect with my patient and they're not going to connect with me. Racial and ethnic minorities receive less information. They're less informed. So why would I take this medicine when you haven't explained anything about what it's you explained poorly what it's supposed to do? Okay. Why would I subscribe to this procedure or surgery or treatment and I get less information? They feel less respected. Again, we have to connect with the patients. The patients, this doctor-patient relationship is just that. It's a relationship, okay? And so how do I implement cultural competent care? Well, I educate myself. I've done a lot of educating myself because I definitely didn't, learn this in medical school per se, okay? So you have to educate yourself, and institutions and practices need to have these educations at play. It just is being more inclusive, being more aware is good for business. They have to see it like, that is truly the case. Being is going to be good for business. It's going to be good for your bottom line. Okay, better outcomes for all your patients means better for business. And so it would be a paramount to put into how can I train my physicians, my healthcare providers, my health workers in my institution or organization to be more culturally competent. Okay, it's going to take actually training and educating, checking our biases, paying attention, talking about this, and informing yourself. And so, one statistic that, I always, talk to my colleagues about is that non-white patients who have ethnically concordant physicians have better outcomes, especially Black patients. I mean, Black babies are less likely to die with Black pediatricians. Black patients tend to have better outcomes and better adherence with Black doctors. Okay. Now, great. So we should diversify our workforce, but we should also change this statistic so it doesn't have to be so. Okay. So it doesn't have to be so. It's past time for us to address this. And so we need to pay attention to the data. We need to pay attention to what we have failed at. And we have failed at providing equal and equitable care to all of our diverse communities. And our population is just becoming more diverse. So if you aren't on the train, you will not survive as a medical institution.